Good morning, everybody. Today, I, Sitara Subbiah, and my fellow presenter Monica Ramachandran from Coorg Institute of Dental Sciences are both honored to be given this opportunity to present for you all today. Now, my friend Monica will start the presentation.
Hello everyone. Our study is a comparative evaluation of oxygen saturation among dental surgeons using N95 filtering phase piece respirator mask and 3M half phase piece elastomeric respirators. We'll be comparing the N95 versus 3M respirators as part of our clinical study. The aim of our study is to clinically evaluate and compare the physiological effect of N95 filtering phase piece respirators and 3M elastomeric respirators on dental surgeons. Okay. The introduction, the usage and importance of phase piece among has exponentially increased during the recent pandemic outbreaks as mandated by the government. Filtering phase piece respirators are the most commonly used, with N95 filtering phase piece respirators being the most popular overall. But the physiological impact of N95 filtering phase piece respirators, elastomeric respirator long-term use are yet to be understood. Now, before we move on further, I'd like to explain what an N95 and an elastomeric respirators are. The N95 face mask protects against respiratory droplets. The letter N signifies that the mask is not resistant to oil. The number 95 signifies that it is at least 95% efficient in filtering particles with a median diameter of less than 0.3 microns. Now, what are 3M elastomeric respirators? Elastomeric respirators are commonly used in industrial and mining settings, but can also be considered for use in the health setting in times of increased demand, such as during infectious outbreaks. Elastomeric respirators, such as half face piece or full face fitting respirators, face are made of or natural rubber material, can be repeatedly used, disinfected, and reused. Elastomeric respirators also differ from disposable and masks in that they have a phase and is air travel to the contaminated and re-aerosolized particles. Compared to disposable respiratory masks, filter elastomeric respirators have about 60
Now, to move on to our clinical study, the material and method that we used. Two groups of 24 participants each using N95 FFR masks and 3M elastomeric respirators respectively. The parameter we evaluated was oxygen saturation levels, and the readings for each individual were taken before the start of the procedure, 30 minutes into the procedure, and after the completion of the procedure. The equipment that we used was a standard fingertip pulse oximeter. These were our results. Our results are represented in a bar graph form. As you can see in this bar graph, there is a uniform reduction in the oxygen saturation levels for both 3M respirators as well as N95 masks, but there is only a statistically significant drop in oxygen saturation levels in the dental surgeons using 3M elastomeric respirators. Now we move on to our discussion. The N95 face mask is generally well tolerated with minimal adverse effects such as vague discomfort, mask tightness and difficulty breathing, and acne. Hypoxemia was similarly observed from the use of the N95 face mask, where increased respiratory rate and higher incidence of chest discomfort were observed during the use of N95 face mask for a 4-hour stretch. 3M elastomeric respirators. Pressure or tractional forces from the mask and the goggles together with accompanying straps may lead to local tissue damage and exert an irritative effect on the underlying superficial sensory nerves, in particular the trigeminal or occipital nerve branches, innervating the face, head, and cervical region. This causes headache, facial pain, and earlobe discomfort. The respirator masks with particulate filters can be used for an extremely long duration in a hospital setting, at least 1 year, so long as the filter is not damaged or soiled. Elastomeric respirators also differ from disposable N95 masks in that they have a separate exhale vent and exhaled air does not travel through the contaminated filter and re-aerosolize trapped viral particles. This is in contrast to disposable N95 masks, which, when reused, may carry an increased risk of transferring viral particles from one patient to another. Currently, the CDC recommends that healthcare providers that will be within 3 feet of a suspected or confirmed COVID 19 patient without a mask, or if providers are in the room for an aerosolization procedure, the provider may voluntarily utilize higher level of protection than N95 masks, such as elastomeric respirators. When comparing reuse of single-use N95 masks versus elastomeric respirators, there is a clear benefit of the latter, as the material and efficiency of the filter will not degrade from repeated donning and doffing. Now for our conclusion, elastomeric face piece masks have several advantages over reusing disposable N95 masks. They provide safe, reusable protection, can be easily cleaned, and have lower risk of transmitting infection between patients. But clinically, there appeared to be a 2% decrease in oxygen saturation levels in comparison with N95 masks, which only had a 1% decrease on subsequent checks. Since we have only studied one parameter, that's oxygen saturation, it cannot be said that N95 masks are physiologically a better option than 3M respirators. We both thank you so much for this opportunity, and we hope you all stay safe in this pandemic time. Thank you.